Limitation to the head. Your teammate was able to move to you and is responsive. You are behind cover, not under hostile fire, and security has been established. You must begin treatment while waiting on medical personnel to arrive. The casualty is conscious and alert. You are in mission-oriented protective posture level 3, so MOP level 3. Standards. Perform all tasks to standard in sequence within 5 minutes without causing further injury to the casualty. All right, so first thing you're gonna do is you're gonna ask the casualty 3 questions. You ask him, what is your name? Where are you? What is today's date? The grader will respond with, the casualty responds appropriately. All right, once you get that prop, you're gonna go ahead and sit the casualty up. Can you sit up for me? Your casualty is conscious and alert, so all you have to do is ask him to sit up. You don't have to pick him up and throw him up against the post. All right, just ask him to sit up. All right, after that, you're gonna identify what side of the head the wound is on, which is identified by this red yarn. All right, once I've identified the side of the head that the wound is on, I'm gonna ask him to turn his head to the opposite direction. Hey, can you turn your head this way? Avoid using left and right. You do not want to get confused as to what side you need to turn his head on, or him be confused as to what side you're asking, and he turns the opposite way. You take the helmet off, and then you become a no-go. All right, so again, you're just gonna point and tell him to turn his head. Point your head this way. He turns his head. We can go ahead and remove the helmet. Place that off to the side. And now I need to remove the hood. I'm gonna go ahead and grab this Velcro underneath his chin, undo it, and then I'm gonna pick the hood up and move it off his head. All right. Now I'm gonna reach into his 1-quart canteen pouch, which represents his IFAK on the left side of his flick. Remove the only thing with it that's in there, which is this bandage. Expose the sterile gauze by not touching it at all. All right, then I'm gonna go ahead, spread your feet, and place the bandage on his wound. All right, I'm gonna stretch the white sterile gauze out and place it on his wound. All right, stretch this top corner of the end piece towards his ear, and then the rolled portion towards the base of his neck. Keeping my tension on the bandage, I'm gonna begin to wrap it around his head. As I'm wrapping it, I'm only unwrapping a little bit, stretching the bandage, and then pulling it and placing it on his head. Unwrap a little bit, pull the bandage, place it on his head. All right. Once I get here to this pressure bar, I'm gonna go underneath it, and then I'm gonna come up and over the top of his head, covering up all this white portion that's at the top. All right. Now I'm gonna hold the bandage in place on this side of his head, and I'm gonna wrap back around. You can cover the eyes while wrapping it, but before you finish this task, you must move them above the brim of the eyes.
Remember, your patient's alert, verbal, right, responsive. You cover someone's eyes, you tend to wander around. You're gonna hit some stuff, bump their head.
All right. Once I've fully wrapped the head and I've come to this retaining bar, I'm gonna go ahead and secure that on both sides. The top and the bottom. I'm gonna give it a flick, make sure it's in place. All right. Then I'm gonna inspect my work. I have wrap over his eyes, so I'm gonna pull that up. Inspect the rest of it, the top. I don't see any of the white sterile bandage. On the bottom, I don't see any white sterile bandage. All right, my bar is in a good spot. Now I will state these last 4 statements, okay? So, it's watch, check, treat, and seek, okay? So I'm watching for life-threatening conditions. I'm checking for further injuries, I'm treating for shock, and I'm seeking higher medical aid. After that, if your bandage is good, your grader will stop your time. If he sees something that could cause you to have a no-go, he's going to give you, he's going to tell you that time is remaining. When you hear time remaining, that is a hint telling you that there is something wrong with your bandage. All right, so that's your last chance to look at your bandage, make sure everything's good, and make corrections. Okay, once you are good with your bandage, you tell the grader you are done, and they will stop your time. All right, once your time is stopped, the grader will go and they will inspect your bandage and make sure that everything is good. Okay, some no-goes that we've been getting are people touching the side of the head that the bandage or the wound is on. That is a no-go. Touching the white sterile gauze at any point throughout this task is a no-go. If it slips off and you grab it and you grab the white sterile gauze, you are a no-go. If it slips off and you manage to grab it and then pull it up to where it doesn't touch anything, roll it back up, wrap the head. Okay. If you wrap over this pressure bar, you're putting unnecessary pressure on the wound. That is a no-go. If you wrap through the pressure bar and begin to wrap around the head, you're putting unnecessary pressure on this wound, and you are a no-go. If you place the retaining bar on the wound, that is a no-go. If you finish your task and you put the eyes are still covered, all right, that is a no-go. While you're performing this task, you will be in MOP level 3, which is pants, jacket, pro mask, hood up, helmet on. Okay, if you're not gonna be able to buckle your chin strap while you have all that gear on. Okay, so while you're working on him, leaning over him and stuff, and your helmet falls off and hits the casualty, you are a no-go. If it falls off and does not hit the casualty, pick your helmet up, put it back on, and continue the task. All right. Do we have any questions?
So, we timed on like putting on the mop gear and
Negative.
just get it
So in the
on.
conditions, you are in a patrol in a CBRN environment, so you'll already be
Check.
in MOP level 3.
Yeah, so when it comes to test week, you'll come in, practice right in the training tent, and then when you're ready to actually get tested out, you'll go and don full MOP level 3, and you'll come up to the testing tent where one of my graders will come up to you and ask you if you're ready to test, and they'll bring you inside the tent. Yes.
For the last 4 things that you say, do you want us to just say like the watch, check, treat, or do you want us to say everything?
Say it.
Say everything?
The watch, check, treat thing is just something for you to kind of get you in the area, right? To jog your memory of what to say. If you come up during test week and you say watch, check, treat, we're just gonna stare at you.
Watch, check, treat, seek. So watch for life-threatening conditions. Check for injuries. Treat for shock. Seek medical attention. Okay. Okay. Any other questions? No? Okay. So what we're going to do now, I have a couple of casualties in the training tent, a couple in the testing tent, and one more in the retrain tent. So just break up into small groups, get where you can fit in, and there's some extra bandages too. So if you're waiting a long time for a casualty, just grab a bandage and just practice on your ranger buddy. All right, have them put their pro mask on, just wrap their head. Okay. All right, get that technique down.